Hello, friends. I am a pediatric immunologist and often perform bone marrow transplants for patients with immune problems. Very interestingly, when I told one of my friends that I perform bone marrow transplants, a non medico friend, he was surprised and he asked me very aptly, bone marrow transplant? I heard this is often performed for patients with cancers. So, do you deal with cancers? I said, no, I don't deal with cancers, but we perform bone marrow transplants for patients with immunological problems or immune deficiencies. And he was pretty surprised. And to answer his question, and to answer such a question, which I often face in my practice, as to how can you perform bone marrow transplant for immunology patients, this simple diagram. We all know that the blood cells are being produced in the bone marrow. As you can see in this picture, this is a simple anatomy of a bone marrow, and bone marrow is the factory for production of all kinds of blood cells. In fact, the bone marrow contains something called stem cell, the mother cell, which gives rise to red blood cells, the white blood cells, and the platelets. And what provides us the immune system? What are those cells that fight infections? It is these white blood cells. So, whenever a patient has got a serious immune deficiency, when these white blood cells are not working, either they are not being produced or they are non functional, we can perform a bone marrow transplant. So, basically, by performing a bone marrow transplant from a healthy donor, we are replacing the existing bone marrow with a healthy bone marrow, and those new stem cells will then produce the red cells, the white cells, and the platelets. And it is these white cells which are being produced from the new bone marrow will replace the immune system with a healthy immune system. This is how and this is why we can perform a bone marrow transplant in an immune deficiency patient. Hopefully, this small video will tell all of you out there as to how and why bone marrow transplants can be curative in patients with immune deficiencies. Thank you.